There's been a steep increase in COVID-19 related hospitalizations in South Africa. The biggest spike is in Gauteng at 21%. The Eastern Cape's hospitalizations have increased by 16%, with the Free State and the Northern Cape recording 10% increases. Health Minister Zweli Mkhize has said new restrictions are inevitable as the country nears the third wave, and we're of course waiting to hear from the President later tonight to hear about those restrictions. For more on hospitalizations, we have CSIR Senior Researcher Ridhwaan Suliman joining us via Skype. Thank you very much as always, Ridhwaan, for your time. So earlier in the past week, we saw a 17% increase in hospitalizations nationally. What are the national daily hospitalization figures looking like at the moment?
Good afternoon, Anli. Indeed, we continue to see that increase in new hospital admissions across the country. The last week saw just over 3,200 new hospital admissions for COVID-19 across the country, and that figure remains at 17%, of an increase of 17% week on week. It's not really surprising that we're seeing this increase in hospitalizations. We have been seeing a sustained increase in the number of confirmed cases and the test positivity rate. And after the expected lag, we are now seeing the increase in hospital admissions. The new admissions are being driven largely by new admissions within Gauteng, the most populous and highest burden province, where admissions last week increased by 39% compared to the previous week.
And what do the increases in hospitalizations tell us about increases in test positivity and increases in asymptomatic cases that perhaps have not been tested for?
Well, the hospital admissions confirm that what we're seeing in the rising trend in cases and test positivity is real. Unfortunately, the number of cases that we do see as that increases, that does translate to a proportion of those cases requiring hospitalization. I think in terms of asymptomatic cases, there still is a number of those that we don't necessarily always pick up. We are seeing a rise in the test positivity rate nationally, and as that rises, it indicates that there may be many more undetected cases, and so the reported figures are possibly an underestimate of the true reality of COVID-19 infections across the country.
Ridhwaan, we've been talking about the third wave for quite some time now. Last year, in the initial stages of the pandemic, when the globe was trying to come to terms with how to sort of predict how this virus and infections work, we talked a lot about infection curves. That's pretty much fallen away from our reporting, I think partially because people have become quite COVID fatigued and they're not quite as interested in the exact statistics. But why are we still entering the third wave, and when do we know when we're in the thick of it?
So I think it's important to still monitor the trajectory and monitor all of these different indicators. I think the most important is to try and prepare our hospital facilities for any possible increased demand. When we look at waves, we don't necessarily have any global or standard definition for what defines these. In South Africa, we've adopted a threshold of 30% case loading, 30% of the previous wave's peak, to qualify that the country would be in a third wave. So at the moment, we're recording on average just over 3,700 new cases per day over the last week, and that is up 24% compared to a week ago. But that case loading, if compared to the previous or the second wave peak, is up to 20% of that peak. So formally doesn't qualify the country as officially in a third wave, but for all intents and purposes, we are entering a third wave, and infection rates have been rising across all of the provinces. So it's probably just a matter of semantics. We know that the risk has increased, and the official third wave declaration is just inevitable.
We don't have exact figures on how many health workers have been vaccinated so far, but it's definitely in excess of 500,000. Do you think this is a high enough number to make a difference in how health facilities are able to deal with the third wave, perhaps with more confidence and fewer infections among health workers themselves?
Most likely, I think healthcare workers, as you indicated, about 480,000 were inoculated through the Johnson & Johnson vaccination. And then as we saw the Pfizer vaccination doses being administered as part of the wider national rollout. A number of healthcare workers have also received those doses. Look, in total, we've administered just under 1 million doses, both healthcare workers and citizens over the age of 60, which equates to about 1.6% of the total population. So in terms of that actually having any effect on the epidemiological trajectory or hospital admissions and number of deaths, the total won't necessarily reflect or we won't see that effect on the total figures. But certainly I think if we look at number of healthcare workers, as you say, we don't have the exact figure, but it's between 500 to 800,000 healthcare workers. I think they likely would feel a bit more confident as we enter into the third wave and over the coming winter months. But I think we also do need to bear in mind that vaccination doesn't guarantee that someone won't get infected. So we still need to take those, or healthcare workers still need to take the necessary precautions.
As we heard a little bit earlier, breaking news that President Cyril Ramaphosa is going to be speaking to us all this evening at 7 o'clock to announce possible further restrictions. What restrictions have been shown to be most effective?
Look, at this stage, if we look at where we're at in terms of our epidemiological trajectory, and if we look at the tools that are available in our public health response toolbox, the most important intervention would be restricting gatherings. Particularly restricting large indoor gatherings where ventilation may not be as good as outdoor settings and the risk is increased. So we do need to limit the conditions for super spreading events, and we do know that large gatherings are those most risky for becoming super spreader events. So I think that's probably the most important point. And then I think at this point we probably need to increase the awareness and alertness amongst the general population that the risk has increased, and so possibly maybe an increase in the alert level for people to indicate people should adjust their behavior as the risk has now increased. And then finally, I think we need to look at the hospital readiness, particularly in the provinces that are seeing the largest surge of cases. And as we talked about, that will translate into an increased burden in the healthcare and hospital facilities. So I think those three things need to remain the focus at this stage.
What have we seen so far in people's behavioural patterns between the second wave and now in terms of big social gatherings?
I think we've certainly seen evidence, at least anecdotal evidence, that people have been attending more gatherings. We've seen larger gatherings, particularly from the Easter period up until now. And we don't quite have the data to support or to indicate, but possibly any of those gatherings could have turned into super spreading events, which speeds up the rate of transmission across communities. I think people are COVID fatigued, and that's fair enough. I mean, we've been in this for over 14 months, and people certainly want to try and go back to some sort of normality. But I think now that as the risk has increased and we're seeing a larger number of infections, I think we do need to understand that we do need to try and adjust our behavior to try and slow down and minimize the transmission that we're seeing. Ultimately, it still remains in our hands that how far this third wave trajectory does go and how long it does last still remains in our hands.